Okay, if you're a nursing student, you already know. GI disorders can feel like one of the absolute toughest sections on your exams, right? But what if I told you there's a much better way to prep than just, memorizing endless facts? Well, stick with me because we're about to give you a special preview of how CSMRN trains you to think like a seasoned nurse so you can walk into those exams and tackle those tricky questions with total confidence. Think about it. On these big exams, it's not about how many facts you can cram into your brain. It's about knowing the right ones. Because those tiny, subtle clues, the ones that separate two conditions that look almost identical, that's everything. That can be the difference between passing and failing, and honestly, more importantly, between the right call and the wrong one for a real patient. And you know what? This right here, this is the real challenge, isn't it? So many of us, we know the textbook definitions for things like hepatitis or colitis. But exams, they don't care about definitions. They give you a whole clinical scenario, a patient's story, and they expect you to apply what you know. And that's exactly where things can fall apart. So, does this list look familiar? I bet it does. And you're definitely not alone. Trying to figure out if that pain is coming from the liver, or the pancreas, or the intestines, or spotting a complication just before it spirals into a full-blown crisis, and then figuring out what to do first. See, this is all about applying your knowledge, not just regurgitating facts. So let's break down exactly how CSMRN totally changes the game here. All right, let's jump right in. First up, systemic crisis, the liver. We're going to connect organ failure to the patient's symptoms. Okay, picture this. You've got a patient with advanced liver disease, and suddenly they're confused and their speech slurred. Now, your brain might immediately jump to something like a stroke, right? But wait, the real clue, the golden ticket, is that history of advanced liver disease. So how in the world do you connect those two dots? And here's the aha moment. This is the clinical reasoning path. The liver is basically your body's master filter, right? It clears out toxins, especially ammonia. But when that liver starts to fail, that ammonia has nowhere to go. So it builds up in the blood, travels straight to the brain, and bam, it's essentially toxic. That's hepatic encephalopathy. See how that works? The confusion, the slurred speech, they aren't random at all. They're a direct result of the liver not being able to do its one crucial job. All right, next up, pattern recognition with IBD. Let's dig into distinguishing Crohn's disease versus ulcerative colitis. Okay, let's try another one. A patient comes in with, listen closely, continuous inflammation of the colon and bloody mucus-filled stools. These aren't just random symptoms thrown at you. They're very specific puzzle pieces, a pattern that points you right to the answer if you know what you're looking for. And this is where the CSMRN way of thinking is such a game changer. Forget memorizing a giant list of symptoms for both. Instead, we focus on the core differences. Think of Crohn's like skipping lesions. It pops up in patches all over the GI tract. But ulcerative colitis, that's a continuous inflammation, usually starting down at the rectum and working its way up. So that one single word, continuous, from our question, that was the entire key. That's the whole puzzle, solved. Okay, let's move on to identifying abdominal emergencies. This is all about recognizing those high-risk, high-urgency conditions. All right, the pressure's on. You've got a patient with severe abdominal pain, and they say it's radiating straight to their back. Then the lab calls, and their enzymes are through the roof. What is screaming at you right now? What's the first thing that should be on your mind? This is textbook pancreatitis. It absolutely screams pancreatitis. And it's not just one thing, right? It's the whole package, the specific cluster of red flags. You've got that severe pain radiating to the back. You've got signs of shock, tachycardia, hypotension, and then the lab confirms it with elevated amylase and lipase. Recognizing this deadly pattern isn't just for an exam, it's what saves lives. And just as critical, here's another one to have on your radar. Peritonitis, that rigid, what they call board-like abdomen, that is a huge warning sign. You pair that with a rebound tenderness, signs of shock, you're dealing with a true emergency. Again, it's about seeing the whole cluster of symptoms together and knowing you have to act fast. Okay, last framework for this preview, mucosal damage and ulceration. Let's frame the cause, symptom, and complication pathways. So listen to this one. A patient tells you they have this burning epigastric pain. But here's the kicker. It happens 2 to 3 hours after they eat. The most important clue here isn't the pain itself, it's the timing. This is not a random detail, I promise you. This is one of those high-yield clues that exam writers absolutely love. And here's why that timing is absolutely everything. It's so logical when you think about it. If the pain hits like 30 minutes after a meal, it's probably a gastric ulcer, right when food and acid are churning in the stomach. But if the pain comes 2 or 3 hours later, well, the food and acid have moved on to the duodenum. That strongly suggests a duodenal ulcer. It's a simple, elegant timing trick that can score you major points. So we've covered systemic crises, pattern recognition, and emergency red flags. Let's pull this all together now and show you the CSMRN clinical edge for exam success.
And here it is, the secret sauce. This is the formula we've been using this whole time. Step 1, recognize those symptom patterns. Step 2, connect those symptoms back to the system that's in trouble. Step 3, identify the biggest, most immediate complication risk. And finally, step 4, choose the correct nursing response. See? This isn't about memorizing. This is a process. This is how you learn to think like an expert.
And that, right there, is the fundamental difference. CSMRN is not just another platform that dumps a bunch of facts on you about GI diseases. No way. We train you to see how these conditions actually evolve, and more importantly, how they show up in real patients, just like they will on your exams. Because at the end of the day, on your nursing exams, the right answer always depends on what the patient's symptoms are telling you. They're telling a story, and our job is to learn how to read it. So, the real question is, for you, are you ready to finally stop memorizing and start thinking like a clinician? What you saw today was just a tiny preview. The entire full advanced gastrointestinal framework is waiting for you inside CSMRN. Thanks so much for watching.